Multnomah County and Street Roots Domicile Unknown report shows in 2019, 113 people died on the county's streets, the highest since they started these reports nearly a decade ago.
This report is foundational for our advocacy efforts because it really is so clear what's at stake, that the difference between housing and homelessness is the difference between life and death.
The year prior, 92 people died. The year before, 79. Since 2011, when the county and medical examiner started tracking deaths among the homeless, at least 643 have died trying to survive outside.
This is an absolute minimum estimate. I know the number is substantially higher, but if we were unable to confirm houseless status, we did not include them, and those statistics are included in the report. I think.
That said, the proportion of deaths in the homeless community remains steady. 3/4 of those who died in 2019 were men. The average age for all, 46 years old. The vast majority were white.
113 of our neighbors dying years before their time and in situations that were largely preventable. Today is about them.
Drugs or alcohol caused or contributed to more than half of the deaths last year. Meth and amphetamines were the leading killer.
And not just by a little.
Others died of trauma, natural causes, and suicide.
That really underscores the needs we have to be really addressing mental health in all of our strategies.
6 people were victims of homicide. About half the people died outside, in parks, sidewalks, homeless camps. Most happened in downtown Portland and near freeways, but also across the city. Not surprising, more died in the colder months. All this highlighting the need for services.
The rent keeps going up, and so the work that we do to place people in housing and give them the support services that they need gets harder and harder.
Morgan Romero, KGW News.